Good morning, and thank you all for joining us. As you're all well aware, the increase of swine flu cases around the world is causing some serious concerns for healthcare professionals. As of this morning, we have 16 confirmed cases here in Texas, including one fatality. And certainly our thoughts and prayers are with those families, and particularly in the instance of the family who has loss of life. Now, here in a minute, Dr. Lakey is going to share more information on that case, along with the details of the state's aggressive approach to this public health challenge. I think it's very important to note that Texans can be confident that we're making every effort to stay ahead of the curve to keep them and their families as safe as possible. It's helpful to start with a bit of perspective. Texans are no stranger to the flu. We get flu shots in the fall. We deal with the symptoms when they hit, typically in the winter months. Right now, the typical Texas flu season is winding down, but we're watching a new strain manifest itself. And this is a new variant that can cause serious trouble if left unchecked. Fortunately, we have a detailed plan in place to deal with this very situation, an approach based on extensive research, careful planning, and collaboration with our partners all across the state. We've not only rehearsed this plan repeatedly, we have honed our team approach to disaster management during our response to numerous storms and wildfires and floods and other challenges that this state has faced over the last years. Led by Dr. Lakey, Jack Colley, the folks in our Division of Emergency Management, we've been executing our pandemic flu plan ever since we got word of the initial cases in Schertz. And as part of that plan, I'm issuing a disaster proclamation today which covers the entire state. Obviously, the virus has not been detected in every county, but this step will move Texas to a higher state of alert and release resources to address the spread of the virus. For example, the CDC has responded to my request by releasing 25% of our antiviral medications from the National Strategic Stockpile. These 850,000 doses of antiviral drugs will augment the 840,000 doses that our legislature funded in the last session to ensure that we have an adequate supply and allow us to replenish hospitals and pharmacies if needed. Our statewide medical team, under the leadership of Dr. Lakey, is coordinating with our Office of Homeland Security, staying in constant contact with the local public health care organizations, and interacting with our federal partners as we execute a plan to keep Texans safe. I have had a number of phone calls with our federal counterparts. Senator Cornyn just on the phone this morning. Vice President Biden called yesterday offering their assistance. Our citizens need to know two things. One, there's no need to panic. The incidences of swine flu have been limited in number with symptoms that are generally mild. Number two, you can be confident that our state's level of preparedness is at the appropriate height. I urge our citizens to act responsibly in the course of this situation, heed the advice from local and state health officials, take the necessary steps to stay healthy. As Texans always do when facing a challenge, we prepare for the worst, we pray for the best. Working together, we will get through this challenge as well.